Nursing, hospital-acquired infections, HAIs, with an NCLEX Style Question. HAIs can be termed hospital-acquired infections or healthcare-associated infections. HAIs are infections that are acquired because of exposure to microorganisms in a healthcare setting. The two types of hospital-acquired infections are nosocomial and iatrogenic. Nosocomial means originating in the hospital. For example, a patient is in the hospital to have surgery. The patient doesn't have MRSA, but while in the hospital, the patient acquires MRSA, a hospital-acquired infection. Secondly, iatrogenic means coming from a procedure. For example, a person goes to the hospital. They do not have a urinary tract infection. At the hospital, the nurse places an indwelling Foley catheter in the patient. The patient gets a catheter-associated urinary tract infection called CAUTI. The CAUTI would be an example of an iatrogenic HAI. Around one-third of HAIs are preventable. Healthcare providers often transmit HAIs from patient to patient through direct contact. The first line of defense to prevent the spread of HAIs includes hand washing before and after patient contact or procedures. Proper hand washing is the most important preventative measure for HAIs. Hand washing should be frequent and thorough with soap and water. If caring for a patient with diarrhea, it is very important to use soap and water instead of hand sanitizer because diarrhea can be extremely infectious. If transmission precautions are necessary, a nurse will post signs outside the door of a patient's room. You can learn more about transmission precautions in the video linked in the description. Disposable equipment can be used inside the room to prevent the spread of germs. Be sure to decontaminate equipment by sanitizing with alcohol wipes after each use. The NCLEX Style Question states, the nurse manager has noted a recent increase in the incidence of hospital-associated infections known as HAIs on the unit. Which nursing actions should be prioritized in the response to this trend? A. Double glove use during procedures. B. Frequent and thorough hand washing. C. Prophylactic broad-spectrum antibiotics. D. Fitting and appropriate use of N95 masks. The answer is B. Frequent and thorough hand washing. If this content was helpful, please subscribe to the channel and click the notification bell to see more videos. Type the words "I subscribed" in the comments so that I can thank you personally. Once again, thanks for watching.